Hey everyone, this is Dr. Medicine RX, and in today's video we'll be discussing about primary syphilis. Primary syphilis is also known as primary sore, hard chancre, Hunterian chancre. Coming to the incubation period, as we already discussed, it is between 9 to 90 days and depends upon the size of the inoculum. The average is about 3 weeks or 21 days. Coming to the gender that is commonly involved, males are commonly involved than females, and the age group that commonly presents with primary syphilis is 20 to 30 years. The course of the primary syphilis is that it starts as a small dull red macule which develops into a papule that later breaks down into an ulcer and that heals with atrophic scarring. Coming to the clinical features, the site involved depends upon the site of the inoculation, basically where the inoculation has occurred, but the genital areas are more commonly involved and are seen in about 90 to 95% of the cases. In males, the common genital area involved is the coronal sulcus, the glans penis, the frenulum, the prepuce, the penile shaft, and in cases of homosexual males, the anus, the anal canal and rectum can also be involved. In females, cervix is involved in about 50% of the cases, but other areas involved include the outer and inner aspects of the labia, the vulva, the clitoris, the urethral orifice and the foreskin. Other areas that can also be involved include some entities such as the condom chancre. In this, the proximal portion of the shaft of the penis, even the pubis and the groin are involved when the penis is protected by condom. And then kissing ulcers, here kissing ulcers, adjacent ulcers occur on the urethral meatus and the coronal sulcus, and extragenital chancres are seen in about 5 to 10% of the cases, and they are painful and they can involve the lips, the tongue, the tonsils, fingers and the breasts. Then as discussed, there is an entity called as syphilis DML where primary chancre does not occur. This is seen about 15 to 30% of the cases, and the patients they directly present with features of secondary syphilis. It is seen in cases where there has been a blood transfusion or punctured wound with infected blood. In pregnant women, the primary chancre it is going to be larger and more indurated because of increase in vascularity. Coming to the classical features of the chancre, this chancre is going to be single and it is going to be dusky red. And the three main important features are that it is non-itchy, it is painless and it is indurated. Hence why it is called as hard chancre. The shape is round to oval and the size varies from 0.3 to 3 centimeters, and the edges and the borders are going to be rolled out or raised. They are going to be well defined and regular, and they may sometimes merge into the surrounding tissue. The base is ham colored and is smooth, and sometimes it can have a grayish slough or hemorrhagic crust, and it is most importantly indurated because of the mucoid content. And because of this induration, it is hard on palpation and therefore it is called as hard chancre. The floor it is going to be clean with dull red granulated tissue. Some of the other features of syphilitic chancre is first is the Dory-Flop sign, where an indurated ulcer when present on the inner prepuce gives a flip and retraction of the prepuce. Then there is going to be regional lymphadenopathy. It is usually unilateral. If the anogenital areas are involved, it is going to be bilateral. And this lymphadenopathy, it appears within a week and it is going to be painless, and the lymph nodes are going to be small to moderate in size. They are non-suppurative, they are firm and they are rubbery in consistency and are lead short-like. This syphilitic chancre, it heals in 3 to 6 weeks and leaves a thin atrophic scar. Coming to the investigations, dark field microscopy from the ulcer base or the exudate shows the tryponims. Then we can also do PCR or direct fluorescent absorption for tryponimal pallidal assay. Then ELISA, all these help in confirmation of the diagnosis. Then among the non-tryponimal tests, they can be either reactive or non-reactive. If they are reactive, then it helps to support the diagnosis and it is also required for follow-up. If they are non-reactive, then we have to repeat the test at 1 week, 1 month and 3 months after the appearance of the chancre. If they are still non-reactive even after 3 months, then we have to exclude the diagnosis of syphilis and look into other possible diagnoses. Histopathological examination can also be done, and in histopathology We can see epidermal hyperplasia with intense lymphohistiocytic and neutrophilic infiltrate, and the dermis it shows plasma cells, and the vascular changes include the endarteritis and periarteritis. The ulcer surface it shows fibrin exudates and necrotic tissue fragments and polymer of nuclear leukocytes. After the ulcer heals, then the epidermis can show acanthosis, spongiosis with neutrophilic and lymphocytic infiltrate, and the dermis can also show dense infiltrate, and the blood vessels they show endarteritis obliterans. The complications include phimosis, erosive balanitis, lymphangitis, and thrombophlebitis of dorsal vein. Some of the differentials to be considered include LGV, chancroid duodenognosis, and herpes genitalis. Thank you. Subscribe for more.